Hello, friend. Today we are going to discuss basic course on mental health diseases, part 2. In this episode, we are going to discuss the understanding of mental health disorders. In this disorder, we have got so many diseases of mental health like anxiety disorders, panic disorders, depressions, psychotic diseases. All these we are going to discuss. First of all, anxiety disorders. These are the main cause of stress. Generalized anxiety disorders called GAD. Definition of these disorders is GAD is a mental health condition characterized by persistent, excessive, and uncontrollable worry about various aspects of daily life. Individuals with GAD often anticipate disaster and may be overly concerned about health, finances, work, family, or other issues. This worry is difficult to control and can interfere with the daily functioning of their life. Symptoms of GAD. People with GAD experience a range of symptoms which can be categorized into physical, emotional, and cognitive symptoms. First of all, physical symptoms. Muscle tension in all the muscles, fatigue generalized, restlessness or feeling on edge, difficulty sleeping called insomnia, headaches, irritability, sweating, nausea or gastrointestinal issues, rapid heartbeat or palpitations. Emotional symptoms, persistent worry or anxiety all the time, feeling overwhelmed or unable to control worry, irritability, feeling nervous or easily startled. In cognitive symptoms, difficulty concentrating or mind going blank or foggy, overthinking solutions to worst scenarios, indecisiveness due to fear of making the wrong choices. Causes of GAD. The exact cause of GAD is not fully understood, but it is believed to result from a combination of genetic, environmental, and psychological factors. Genetics. Family history of anxiety or other mental health disorders may increase the risk. Brain chemistry. Imbalances in neurotransmitters such as serotonin and dopamine may play a role. Personality. Certain personality traits such as being highly sensitive or having a tendency to worry can contribute to GAD. Environmental factors, stressful or traumatic life events, chronic illness, or exposure to stressful environments can trigger GAD. Psychological factors, negative thinking patterns, poor coping skills, and past trauma can contribute to the development of GAD. Diagnosis of GAD. To diagnose GAD, healthcare professionals typically use criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Excessive anxiety and worry occurring more days than not for at least 6 months. Short about various activities or events. Difficulty controlling the worry. The anxiety and worry are associated with 3 or more of the following symptoms, like restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbances like difficulty falling or staying asleep, or restless, unsatisfying sleep. The anxiety, worry, or physical symptoms cause significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not attributable to the physiological effect of a substance, that is a drug, of abuse, a medication, or another medical condition, and is not better explained by another mental disorder. Treatment. GAD is treatable, and a variety of approaches can help manage symptoms. Common treatments include: number one is psychotherapy. Cognitive behavior therapy, CBT, is highly effective for GAD. It helps individuals identify and challenge negative thought patterns and develop healthier ways of thinking and coping. Acceptance and commitment therapy, called ACT. ACT, or acceptance and commitment therapy, focuses on accepting anxiety as a part of life and committing to actions that align with personal values despite anxiety. This is just like EFT, emotional freedom techniques. Number two, medications. Selective serotonin reuptake inhibitors, SSRIs, commonly prescribed antidepressants that can help reduce anxiety symptoms. Serotonin norepinephrine reuptake inhibitors, SNRIs, another class of antidepressants effective for anxiety. Benzodiazepines. These can be used for short-term relief of severe anxiety symptoms, but they carry a risk of dependence and are generally not recommended for long-term use. Buspirone, an anti-anxiety medication that can be used for GAD. Lifestyle changes and self-care. Regular exercise, physical activity can reduce anxiety and improve mood. Healthy diet. Eating a balanced diet can impact overall well-being. Adequate sleep, ensuring sufficient and quality sleep, can help manage anxiety. Stress management techniques, practices such as mindfulness, meditations, deep breathing exercises, and yoga can help reduce anxiety levels. Sports groups. Joining a sport group can provide a sense of community and understanding and allow individuals to share experiences and coping strategies. Prognosis and summary. With the appropriate treatment, many individuals with GAD can manage their symptoms and lead fulfilling lives. Early interventions and combination of therapies often result in the best outcomes. However, treatment may need to be ongoing as GAD can be a chronic condition. Summary. Generalized anxiety disorders is a common and treatable mental health condition characterized by persistent and excessive worry. Understanding its symptoms, causes, and treatment options can help individuals seek appropriate care and manage their conditions effectively. Panic disorder. The other disorder is panic disorders, deep-rooted past event or trauma may be the cause. Definition. Panic disorder is a type of anxiety disorder characterized by recurrent and unexpected panic attacks. A panic attack is a sudden episode of intense fear or discomfort that peaks within minutes and includes a variety of physical and cognitive symptoms. People with panic disorder often live in fear of having another panic attack, which can significantly impact their daily lives. Symptoms of panic attacks. Panic attack typically involves a combination of the following symptoms. Physical symptoms include palpitations, pounding heart or accelerated heart rate, sweating, trembling or shaking, shortness of breath or sensation of smothering, feeling of choking, chest pain or discomfort, nausea or abdominal distress, dizziness, lightheadedness or feeling faint, chills or heat sensations, numbness or tingling sensations, cognitive symptoms, fear of losing control or going crazy, fear of dying, feeling of unreality, derealization or being detached from oneself, that is depersonalization. Causes of panic disorders. The exact cause of panic disorder is not fully understood, but it is likely involves a combination of genetic, biological, environmental, and psychological factors. Genetics. A family history of panic disorders or other anxiety disorders can increase the risk. Brain chemistry and imbalances in neurotransmitters such as serotonin and norepinephrine may contribute to panic disorders. Stress and trauma. Significant stress such as the death of a loved one, a major life change, or traumatic experiences can trigger panic disorders. Personality factors. Certain personality traits such as a tendency toward negative emotions or high sensitivity to stress may increase the risk. Diagnosis of panic disorders. Diagnosis of panic disorder is based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders DSM-5. Recurrent unexpected panic attacks, at least 2 unexpected panic attacks where the individual did not anticipate the attack. 1 month or more of concern or behavioral changes. Persistent concern or worry about additional panic attacks or their consequences, that is losing control, having a heart attack, etc. Significant maladaptive changes in behavior related to the attacks, that is avoiding situation where panic attacks have occurred. Symptoms not attributable to other causes. The panic attack and worry are not due to the physiological effects of a substance, that is drugs or medication or another medical condition, and they are not better explained by another mental disorder, that is social anxiety disorder or specific phobia. Treatment. Panic disorder is treatable and a combination of therapies often provide the best outcomes. Psychotherapy. Cognitive behavioral therapy is given. Exposure therapy, a type of CBT where individuals are gradually exposed to the physical sensation of panic in a safe environment, helping them learn to manage their anxiety. Medications, selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, benzodiazepines, beta blockers, sometimes used to manage the physical symptoms of panic attacks, lifestyle changes and self-care, regular exercise, healthy diet, adequate sleep, stress management techniques, practices such as mindfulness, meditation, deep breathing, exercises, and yoga can help reduce anxiety levels. Sport groups, joining a sport group can provide a sense of community and understanding and allow individuals to share experiences and coping strategies. Prognosis and summary. With appropriate treatment, many individuals with panic disorders can manage their symptoms and lead fulfilling lives. Early interventions and combination of therapies often result in the best outcomes. However, treatment may need to be ongoing as panic disorder can be a chronic condition. Summary. Panic disorder is a treatable mental health condition characterized by recurrent unexpected panic attacks and significant anxiety about having more attacks. Understanding its symptoms, causes, and treatment options can help individuals seek appropriate care and manage their conditions effectively. Moreover, hypnosis can treat this mental disorder permanently. Social anxiety disorders. Definition. Social anxiety disorders, SAD, also known as social phobia, is a mental health condition characterized by intense fear and avoidance of social situations where one might be scrutinized or judged by others. This fear can significantly impact daily activities, work, school, and personal relationships. People with social anxiety disorder experience a range of symptoms which can be categorized into physical, emotional, and behavioral symptoms. Their physical symptoms include blushing, sweating, trembling or shaking, rapid heartbeat or palpitations, nausea or stomach upset, dizziness or lightheadedness, shortness of breath, muscle tension. Emotional symptoms include intense fear of interacting or talking with strangers, fear of situations where one might be judged or humiliated, fear of being the center of attention, worrying about upcoming social situations for days, weeks, or even months, fear that other will notice anxiety symptoms. Behavioral symptoms include avoiding social situations or enduring them with the intense fear of anxiety, avoiding speaking up in class, meeting new people, or attending social gatherings, making significant lifestyle changes to avoid social situations, that is quitting a job or dropping out of school. The causes of SAD, the exact cause of social anxiety disorder is not fully understood, but it is believed to result from a combination of genetic, environmental, and psychological factors. Genetics, having a family history or social anxiety or other anxiety disorders, can increase the risk. Brain structure, overactivity in the amygdala, a part of the brain involved in fear responses, may contribute to heighten anxiety in social situations. Environment, negative experiences such as bullying, humiliation, or rejection can trigger or worsen anxiety, social anxiety. Personality, individuals with who are naturally shy or introverted may be more prone to developing social anxiety disorder. Learned behavior, observing others with social anxiety or being an environment that reinforce Anxious behavior can also contribute. Diagnosis of social anxiety disorders is based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Persistent fear, marked fear or anxiety about one or more social situations where the individual is exposed to possible scrutiny by others. Fear of negative evaluation, the individual fears that they will act in a way or show anxiety symptoms that will be negatively evaluated, that is humiliated or embarrassed or rejected. Avoidance behavior, the social situations are avoided or endured with the intense fear of or anxiety. Duration and impact, the fear, anxiety or avoidance is persistent, typically lasting 6 months or more, and causes significant distress or impairment in social, occupational, or other important areas of functioning. Not due to other conditions, the fear or anxiety is not attributable to the physiological effect of a substance or another medical condition and is not better explained by another mental disorder. Treatment of SAD. Social anxiety disorder is treatable and a variety of approaches can help manage symptoms. Common treatments include psychotherapy, cognitive behavioral therapy, CBT, social skill training. Medication include selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, then benzodiazepine, beta blockers. Lifestyle changes and self-care include regular exercise, healthy diet, adequate sleep, stress management techniques. In sport groups, joining a sport group can provide a sense of common community and understanding and allow individuals to share experiences and coping strategies. Prognosis and summary. With appropriate treatment, many individuals with social anxiety disorders can manage their symptoms and lead fulfilling lives. Early interventions and a combination of therapies often result in the best outcomes. However, treatment may need to be ongoing as SAD can be a chronic condition. Summary. Social anxiety disorder is a common and treatable mental health condition characterized by intense fear and avoidance of social situations. Understanding its symptoms, causes, and treatment options can help individuals seek appropriate care and manage their conditions effectively. Mood disorders. Major depressive disorders, MDD definition. Major depressive disorder, commonly known as depression, is a mental health condition characterized by persistent feeling of sadness, loss of interest or pleasure in most activities, and a range of emotional and physical symptoms. These symptoms interfere significantly with daily functioning, affecting work, school, and relationships. Symptoms. To diagnose MDD, healthcare professionals look for the presence of at least 5 of the following symptoms, with at least one of the symptoms being either depressed mood or loss of interest or pleasure lasting for at least 2 weeks. Emotional symptoms: persistent sad, anxious, or empty mood, feeling of hopelessness or pessimism, feeling of guilt, worthlessness, helplessness, loss of interest or pleasure in hobbies and activities once enjoyed, irritability. Physical symptoms include fatigue and decreased energy, difficulty concentrating, remembering, or making decisions, insomnia, early morning awakening or oversleeping, appetite or weight changes, significant weight loss or gain, psychomotor agitation or retardation, restlessness or being slowed down, aches or pains, headaches, cramps, or digestive problems without a clear physical cause, severe symptoms, recurrent thoughts of death or suicide attempts, or planning suicide. Causes. The exact cause of MDD is not fully understood, but it is believed to result from a combination of genetic, biological, environmental, and psychological factors. And genetics, brain chemistry, imbalances in neurotransmitters, hormones like changes related to pregnancy, postpartum period, menopause, thyroid problem, and other conditions can trigger depression. Environmental factors, stressful life events, certain personality traits such as low self-esteem or being overly dependent, self-critical, pessimistic may increase the risk of depression. And diagnosis of MDD is based on criteria of DSM-5. The individual must experience 5 or more of the specified symptoms during the same 2-week period, and at least one of the symptoms must be either depression, depressed mood, or loss of interest in players. The symptoms cause significant distress or impairment in social, occupational, or other important areas of functioning. Episode is not attributable to the physiological effects of substance or another medical condition. Symptoms are not better explained by another mental disorder. There are never been a manic episode or hypomanic episode unless they are substance induced or attributable in the physiological effects of an other medical condition. Treatment. Psychotherapy include cognitive behavioral therapy, interpersonal therapy, psychodynamic therapy, and the medications include selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, tricyclic antidepressants, TCAs, monoamine oxidative inhibitors, atypical antidepressants, medication like bupropion and mirtazapine. Lifestyle changes and self-care, regular exercise, healthy diet, adequate sleep, stress management techniques, social support, other treatments, electroconvulsive therapy, transcranial magnetic stimulation, and prognosis and summary. With appropriate treatment, many individuals with MDD can manage their symptoms and lead a fulfilling life. Early intervention, a combination of therapies often result in the best outcomes. Summary: major depressive disorders is a common and serious mental health condition characterized by persistent feeling of sadness and loss of interest or pleasure in activities. Understanding its symptoms, causes, and treatment options can help individuals seek appropriate care and manage their condition effectively. Bipolar disorders. Bipolar disorders definition is also known as maniac depressive illness, is a mental health condition characterized by extreme mood swings that include emotional highs, that is mania or hypomania, and lows in depression. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Types of bipolar disorder. There are several types of bipolar disorder, each characterized by different patterns of mood episodes. Bipolar 1 disorder defined by manic episode lasting at least 7 days or by manic symptoms that are so severe that immediate hospital care is needed. Depressive episode typically last at least 2 weeks. Mixed episodes, simultaneous symptoms of both mania and depression are also possible. Bipolar 2 disorders defined by a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episodes that are typical of bipolar 1 disorder. Cyclothymic disorders, cyclothymia, defined by periods of hypomanic symptoms as well as periods of depressive symptoms lasting for at least 2 years, 1 year in children and adolescents, but the symptoms do not meet the diagnostic requirement for a hypomanic episode and depressive episode. Other types include bipolar and related disorders induced by certain drugs or alcohol or due to medical conditions. Bipolar disorder involves episodes of mania, hypomania, and depression, each with distinct symptoms. Mania, elevated, expansive, or irritable mood, increased activity or energy, inflated self-esteem or grandiosity, decreased need for sleep, more talkative than usual, or feeling pressure to keep talking, flight of ideas or feeling that thoughts are racing, distractibility, increase in goal-directed activity, either socially at work or school or sexually or physical restlessness, excessive involvement in activities that have a high potential for painful consequences, that is unrestrained spending, sprees, sexual indiscretions, foolish business investments. Hypomania, similar to mania but less severe and not causing significant impairment, social or occupational functional. There are no psychotic features in hypomania. Depression, persistent, sad, anxious, or empty mood, feeling of hopelessness or pessimism, feeling of guilt, worthlessness, or helplessness, loss of interest or pleasure in most activities, decreased energy or fatigue, difficulty concentrating, remembering, or making decisions, insomnia or oversleeping, changes in appetite or weight loss or gain, restlessness or slowed behavior, thoughts of death or suicide attempts. Causes of bipolar disorder. The exact cause of bipolar disorder is not fully understood, and there may be some genetics, brain structure, and functional differences in the brain structure and function may contribute, and environmental factors may contribute, neurotransmitters imbalances, chemical imbalances in the brain involving neurotransmitters such as serotonin, norepinephrine, and dopamine are believed to play a role. Diagnosis by DSM, manic episodes, a distinct period of almost abnormally or persistently elevated, expansive, or irritable mood, and abnormally and persistently increased activity or energy lasting at least 1 week and present most of the day, nearly every day. During this period, there are 3 or more of the following symptoms, or if the mood is only irritable, may be present: inflated self-esteem or grandiosity, decreased need for sleep, more talkative than usual, and a flight of ideas and distractibility. Increase in goal-directed activity or psychomotor agitation, excessive involvement on activities with a high potential for painful consequences, and hypomanic episodes similar to manic episode but lasting at least 4 consecutive days and not severe enough to cause significant impairment in social or occupational functioning or to necessitate hospitalization. Major depressive episode, 5 or more of the specified symptoms present during the same 2-week period, with at least one of the symptoms being either depressed mood or loss of interest or pleasure. Treatment: bipolar disorders is treatable, and combination of therapies often provide the best outcomes. Medications, we give mood stabilizers like lithium valproate, carbamazepine are commonly used to control manic and depressive episodes. Antipsychotic medications olanzapine, risperidone, and quetiapine can be helpful. Antidepressants, these may be used to treat depressive episodes. Antidepressant, antipsychotic combination, Symbiox, a combination of the antidepressant fluoxetine and the antipsychotic olanzapine, treats symptoms of depression and mania as well. Psychotherapy, cognitive behavior therapy, psychoeducation, interpersonal and social rhythm therapy, these are given. And lifestyle changes and self-care, regular exercise, healthy diet, sleep, hygiene, stress management techniques, avoiding alcohol and drugs, substance use can worsen symptoms and interfere with medications. Prognosis and summary. With appropriate treatment, many individuals with bipolar disorders can manage their symptoms and lead fulfilling lives. Summary. Bipolar disorder is a serious mental health condition characterized by extreme mood swings between mania, hypomania, and depression. Understanding its symptoms, causes, and treatment options can help individuals seek appropriate care and manage their condition effectively. Psychotic disorders. Schizophrenia definition. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with the reality, which can be distressing for them and for those around them. While it is a complex condition, it is treatable, and most individuals with schizophrenia can lead fulfilling lives with proper support and treatment. Symptoms, positive symptoms are hallucination, delusions, disorganized thinking, disorganized speech, and catatonia. Negative symptoms, flat affect, reduced speech, lack of motivation, social withdrawal, and anhedonia. Cognitive symptoms, trouble focusing, paying attention, memory issues, executive functioning issues. Causes of schizophrenia. Exact cause is not known. Genetics, brain chemistry and structure, environmental factors, and drug use. Certain drugs, particularly cannabis, cocaine, and amphetamines, can increase the risk of developing schizophrenia, especially in those who are already predisposed to the disorder. Diagnosis with the DSM-5, and to be diagnosed with schizophrenia, individual must experience at least 2 of the following symptoms for the significant portion of time during 1 month period: delusions, hallucination, disorganized speech, grossly disorganized or catatonic behavior. Negative symptoms. Treatment. Treatment of schizophrenia typically involves a combination of medications, psychotherapy, and support services. Antipsychotic medications, psychotherapy, supportive services, hospitalization. And prognosis and summary. The prognosis for schizophrenia varies widely depending on the individual and the level of support and treatment received. Summary: schizophrenia is a complex and severe mental disorder characterized by a range of symptoms, including hallucinations, delusions, disorganized thinking, and negative symptoms. Understanding its symptoms, causes, and treatment options is crucial for providing effective support and care for individuals with schizophrenia. Thank you very much.